Hi, I'm Lakshmi, audiologist and speech language pathologist. In my practice, I keep coming across many questions asking by patients regarding ENT problems and solutions. So I thought, why not ask these questions directly to a professional and seek good answers? So here I would like to introduce you Dr. Rakesh, ENT surgeon from Pinnacles Hospital, Visakhapatnam, who is well known for his cochlear implant surgeries and endoscopic nose surgeries. So sir, hi.
Hello.
Thank you for coming for this interview.
Welcome anytime. It's my pleasure doing interview with you.
Sir, here we also would like to know more about throat problems. Many of our patients who come with irritation in the throat or fatigue, from morning their voice is good, by evening they are unable to speak. So I cannot see inside the throat, like how are the vocal cords. So can you suggest what kind of problems they would face and how do we solve those issues?
See, what you're talking about is voice fatigue. Usually voice fatigue is seen in people who have unilateral vocal cord palsy, where the vocal cord is fixed in the midline. Okay, and if it is fixed away from the midline, they have hoarse voice. If it is fixed in the midline, because one vocal cord stays stuck and the other vocal cord keeps doing the function of both, that's why there will be a decrease in voice and it's called as voice fatigue. In the other condition also we see voice fatigue is a reflux. Reflux is nothing but GERD, which is gastroesophageal reflux disorder, which means the acid from the stomach is coming into the throat. That can come when we burp or when we lie down to sleep. So what happens is, when we sleep, the acid from our stomach comes into the throat, burns near the vocal cords and then goes back or sometimes comes into our throat. So what happens is, when that burns, there will be little bit of swelling in between the vocal cords, and vocal cords muscle is one of the finest muscles in the body.
You mean sensitive?
Not sensitive, it is one of the thinnest.
What's thinnest?
One of the thinnest muscle in the body. So what happens is, when this acid falls there and there is edema, that means there is excessive weight of the for which the muscle has to bear. So when we talk for some time or when they talk for some time, that is when they complain of, initially I'm able to speak well, but my voice is going low. And one thing, if you would have noticed, they would tell, when I do my voice becomes normal again.
They clear the throat sometimes and
that means, that it's something like our muscle is spasmed in our hand. We tend to stretch our hand couple of times and the muscle
and then the releases.
So things like that. And most of them not, I don't think they would say by the end of the day. They'll say, even if I speak, there are people who tell, even if I speak for 10-15 minutes, they'll have voice fatigue, or half an hour, depending on the severity of reflux or the duration of the vocal cord, unilateral vocal cord palsy.
So can we say any person who is having gastritis might lead to these voice problems or voice?
See, gastritis is different from GERD. Many people perceive gastritis as GERD because they come to you, they come to me also with change of voice or voice fatigue or irritation in the throat. When I see their throat, when I examine their vocal cords, I find these differences which I was telling you, and I tell them, you have this thing, the acid from your stomach coming into your throat. They refuse to accept it. They tell, doctor, I don't feel any disturbance in my stomach, there is no gas in my stomach, there is no pain in my stomach. That's why gastritis is a different thing. It's correlating, yes, but gastritis is not which results in GERD. There is a thing called silent reflux also, and wherein patients get an endoscopy done, everything, the mucosa, everything looks normal, but still they'll have these complaints. And sometimes we see that the changes in the throat or near the vocal cords are there. And this one is called a silent reflux, because the patient doesn't have any complaints of any gastritis. He'll have healthy feeding habits, everything is healthy, but still the reflux is there. That's why it's called as silent reflux.
Okay. So do you feel that these singers, teachers have to undergo some vocal hygiene tips? Otherwise it might lead up to vocal abuse and things like that. So do you suggest any tips for them to follow? Because
See, actually, singers by default in the good olden days, they were only trained singers. Now we have lots of bathroom singers, and the singers who have become out of passion, they keep hearing to music because they have so much accessibility to music, and they keep trying to sing on their own. So because they don't have proper training of the vocal muscles, and then they don't have the breathing exercises which they have to do for proper singing, they end up having issues with the vocal cords. And vocal cords in singers, there is they get a thing called nodule, vocal cord nodule or a polyp. This is usually seen in, the other names for vocal cord nodule is preacher's nodule, teacher's nodule, singer's nodule, and we see even in politicians. See, all the examples I have given are the people who actually abuse their voice.
speeches.
So, speeches. And when I use abuse their voice, it doesn't mean shouting alone. Even whispering also is voice abuse. That's because when you whisper, you're putting extra stress and tension on the vocal cords or vocalis muscle, and it's not moving like how it moves when we speak in normal tone.
Yeah, other than these vocal cord polyps and vocal abuse, I've seen some patients complain about they're smoking and then they feel the voice irritation is there. Is there any direct relation to smoking and vocal cords abuse or irritation?
There is a direct relation because when you smoke, you take the smoke into the lungs. So as it goes into the lungs, it has to go through the vocal cords. So they by the end of the day, smoke with chemicals. Smoke as such is an allergen. With nicotine, it goes inside, which is an irritant to the vocal cords. And saying that, there are few singers who are very well known world over who smoke before their concert or have a small drink before the concert. That is because of the same thing which I was telling you. As the smoke goes in, it irritates the vocal cords, and the vocal cords are little thicker than the normal because of the irritation. So the voice becomes more bass. So
the voice is more clear. So obviously we should not.
It's not suggested, but there are people who do that. But we have seen that in long run again it results in these vocal cord nodules and all those things.
Okay, and these nodules can be operated and they'll regain their actual vocal cord?
Yeah, they can be operated. It's a fairly simple procedure. There's nothing to worry about. In most often they're not. In 90% of the patients, I see that their voice is regained immediately after surgery. Because what happens is the vocalis muscle, like I told you, is one of the finest muscle, and because of the cyst or the polyp, because of weight, the vocal cord muscle doesn't move properly. So the moment you remove the load on it, the frequency and all that comes back. Saying that, we have to take very, very good care about the layer of the vocalis muscle or the vocal cord membrane.
So the good care?
Yeah, good care while operating, and if we can preserve as much as the normal mucosa which covers the vocal cords, it regains the normalcy because of the waves which actually trigger the speech and things like that.
Okay. Thank you so much.